हेलो।
Hi, Ms. Patel. This is Dr. Shah from the surgery.
हाँ बोलो।
Unfortunately, your COVID vaccine is overdue. Would you like to rebook? Hello? Hello? Mrs. Patel? You there? Hello?
We've all heard about there being a poor uptake of the COVID-19 vaccine in the BAME community. But how bad is the situation in Wales? Recently, the NHS have faced criticism over missing ethnicity data about those who've been vaccinated. Could this give us a false idea of how many people from a black and ethnic background have actually taken the vaccine? Here are some views from these communities.
I really feel like the government are pushing this vaccine on us.
It hasn't taken much time for it to produce the vaccine, and as a result, I'm not sure there's enough testing being done on it.
Now it's just suddenly it's ready to go and it's being injected into people's arms.
I feel it's more worthwhile that everyone does get a vaccine, only because if we're all vaccinated, it just means we can protect each other.
By me taking the vaccine, I can still be a carrier and pass on COVID to other people.
I think vaccines are the way out of it, and that's from kind of reading different articles, listening to the news.
With so much information out there, it's easy to see why people don't know what to believe when it comes to the COVID-19 vaccine. Dr. Bernard Talabani from the Muslim Doctors Wales explains how myths on social media are confusing people.
Some of the myths that we've had to deal with are the vaccine contains microchips. No, they don't. The vaccines have fetal cells. No, they really don't. The vaccines will change your DNA. And once you hear the same video being sent around to you over and over again, and that information goes unchallenged, it's very difficult to actually think, well, hang on, no, this isn't true.
With minority ethnics being highlighted by the media for not taking the vaccine, there is now a growing concern that certain communities are being blamed. Gurmeet Randwa from the Sikh Council Wales says singling out communities could cause serious issues.
It probably will bring a hate crime, increase in hate crime and other things. I haven't seen personally any resistance. I think people are more than happy to go for it. And I think all the people I know of, they have actually, whenever they've been given the appointment, they have opted for it.
Is this a problem that's exclusive to black and ethnic minorities, or is this something that affects society as a whole? Dr. Bernard Talabani says although she sees some resistance, other factors can't be ignored.
I think we overgeneralize quite a lot, and I think we categorize people into these strict descriptions that don't necessarily apply to everybody in that community. What people have focused on is that the BAME community have a reduced uptake of the vaccine. What they haven't mentioned, I think, to the same extent, and it's just as important, that if you have mental health problems, your uptake of the vaccine is just as low, if not lower, actually. If you're from a socially deprived background, your uptake of the vaccine is also low. So it's about understanding why is it that people are not taking up the vaccine.
But is it right to say ethnicity doesn't have an effect? Raphael Esu, who is the COVID-19 leader for the Sub-Saharan Advisory Panel, explains how cultural issues in the African communities may still be holding some people back.
There's a language barrier issue now, especially first-generation immigrants here in Cardiff. So many people, they had to learn English, and English is not their first language, right? And then we identify that every information about COVID is very important. So we started to translate important health information into local language. I can speak very anecdotally when I say that Africans can be superstitious, on the basis of religion. So that's also one aspect. So religion also plays a very huge role.
I've spoken to Rabia, a British Asian from Grangetown. She tells me her reasons for not taking the vaccine are not down to culture.
I haven't taken the vaccine, and I know a lot of people have. It's not actually because of religious reasons or for reasons being that I'm afraid of the vaccine. It's nothing to do with that. It's just that because I'm 27 years old, I feel as though the vaccine has sort of limited advantages for me.
I've spoken to Public Health Wales for a comment, and they say ethnicity data is not routinely collected at the point of vaccination. This is now something they're working towards improving. As a British Asian myself and a healthcare professional, I have chosen to take the vaccine. I understand the importance of it to protect myself and others. However, a question remains. Could educating others be the way forward? And can we all collectively work together as a society to find a way out of this pandemic?
Oh, hello, Mrs. Patel.
Sorry, doctor. What were you saying? I got cut off.